the Hampshire, Franklin, and Worcester District. Senator Comerford offers an amendment. The title, which the clerk shall read.
Amendment number 37 by Ms. Comerford. Telehealth study reviews patient access barriers.
The chair recognizes the gentleman from the 1st Essex and Middlesex District, Senator Ty.
Thank you, Mr. President, and through to the members. Mr. President, I'm hoping that we're going to be able to get an explanation of this amendment, which appears to be a very important amendment relative to fully understanding some of the impediments that continue to exist in Massachusetts relative to telehealth, Mr. President. And so I'm hoping that the gentlelady from Hampshire, Franklin, and Worcester might be able to offer a brief explanation of the contents of the amendment.
The chair recognizes the senator from the Hampshire, Franklin, and Worcester District, Senator Comerford.
Thank you, Mr. President, and through you to the members, thank you also to the esteemed minority leader for this good question. I want to start by thanking the Senate President, the esteemed Chair of Ways and Means, and the gentle and fierce lady from Arlington. And thank you to you and your tireless staff for their work on this outstanding and necessary bill. I'm really proud to speak today in support of the Patients First Act and the important contributions this bill will make to strengthen and improve healthcare in the Commonwealth. Contributions, I believe, are needed now more than ever during the COVID-19 crisis. For me, as for many in this chamber, and this has been echoed today, Mr. President, by colleagues, healthcare is a very basic, essential, universal human right. This bill moves us along that morally, ethically, fiscally right path, and I look forward to working with my colleagues to go the distance necessary to achieve fully universal and accessible healthcare for all in the Commonwealth. Mr. President, when we think of healthcare as a human right, we must recognize that access and affordability are key. And again, thank you to the gentlelady from Arlington. This bill addresses both of those goals. I am urged on today by my incredible constituents in the Hampshire, Franklin, Worcester District, as this bill will help them access and afford the health care they need. Getting to a doctor or a hospital when you need care can take hours in my part of the state, where providers may be dangerously and disproportionately scarce, physically distant, and where public transportation options are very few and very far between. Telehealth can be the critical connection to good care. We've seen the vital role that telehealth can play during the COVID-19 pandemic, and on behalf of my constituents who are clamoring for this, I am delighted and proud that the Senate is working to codify the use of telehealth more permanently. Additionally, allowing trained providers to practice at the very top of their licenses makes sure that more patients have access to the services they need. Again, providers practicing at the top of their licenses are just what's needed in the Hampshire, Franklin, Worcester District, and I've heard strong support from my constituents on this issue. Many of these provisions came before the Public Health Committee, which I co-chair, and I have considered these matters extensively and strongly support their inclusion in this bill. And finally, this bill protects patients from surprise billing practices, which can cause significant financial harm, as my colleagues know well. Mr. President, today I submitted just two simple amendments to build on the admirable work of my colleagues. The amendment being considered currently, amendment number 37, helps ensure that telehealth will be accessible to all patients, including those in rural districts like mine. It adds to the Health Policy Commission study of telehealth implementation a directive to look at the barriers impacting patients, including access to broadband internet and cellular telephone service. And Mr. President, if I may just for a moment, I'd like to speak just very briefly on Amendment 38 as well. This adds another layer of patient protection from surprise billing. If a healthcare provider fails to notify the patient that they are out of network, then that provider can only charge the regular in-network cost. This would end the practice known as balance billing and make sure that patients are not penalized with surprise bills when a provider does not live up to their responsibility. Mr. President, I respectfully urge my colleagues to support these two important amendments. Thank you very much.
The question comes on adoption of the amendment. All those in favor say aye, opposed no. The ayes have it, the amendment is adopted. The same senator offers an amendment, the title which the clerk shall read.
Amendment number 38 by Ms. Comerford, surprise billing protections for patients.
The chair recognizes the senator from the Hampshire, Franklin, and Worcester District, Senator Comerford. Question comes on adoption of the amendment. All those in favor say aye. Opposed, no, and the ayes have it. The amendment is adopted.